I'm John Brisson, author of Fix Your Gut and Health Coach. Welcome to the Fix Your Gut YouTube channel. And tonight we're going to talk about a topic that's very near and dear to my heart. Laryngopharyngeal reflux disease, also known as silent reflux. I was officially diagnosed with silent reflux. It's going on about almost 8 years ago now. About 9 years ago, for the first time in my life, actually, I was at my grandmother-in-law's house eating a fish fry in September of that year, right before my son was born in October. And I had eaten and felt okay, and I actually got gastritis. Even with all my issues, my appendix bursting, my hernia surgery that I had to have done, I never had gastritis or had the feeling of burning in my stomach at all. I've had abdominal pain, but never burning. So I went to the emergency room. They came back and they didn't find any issues or anything wrong with me. And I actually had a panic attack too, which was new for me too. And later I started developing reflux symptoms, but the reflux symptoms were different in that I didn't have typical heartburn or GERD that I would get on occasion if I overate, even when I was a teenager. But I, started losing my voice. I started, getting postnasal drip and having esophageal spasms and bad taste in my mouth, and it sent me on a roller coaster of trying to figure out what silent reflux was and understand the mechanism of it, because at that time no one really knew what the cause of silent reflux was or what even silent reflux really was. Most doctors thought I had gastroesophageal reflux disease, which is GERD, and I started experimenting with proton pump inhibitors at that time, off and on, and Gaviscon, but none of it really helped. It wasn't too. I started, researching natural health, and came across the work of Jamie Kaufman, and using an alkaline water and zinc carnosine supplementation and DGL. That I started making a little bit of headway in my condition, but I thought I may have had silent reflux forever. I knew that the ACE inhibitor lisinopril depleted zinc in my body all those years ago, and may have, my vitamin D levels were low too, and both of those may have contributed to me developing silent reflux, which I think was actually an H. pylori, overgrowth of dysbiosis, that I later tested positive to. After many tests, I tested negative. But yeah, once I started tackling the H. pylori overgrowth dysbiosis that I had, which I talked a lot about on the GERD podcast that me and Jason Hooper had recently done, and I'll have the links in the show note for that for people who are suffering from heartburn or gastroesophageal reflux disease. But yeah, once I tackled the H. pylori, I got better, and I thought my silent reflux may have been permanent too, because of all the gastrointestinal surgeries that I had as a teenager, my appendix rupturing and having peritonitis and hernia repair. But no, I was wrong. It was because of the H. pylori, and once I got that dysbiosis under control, my silent reflux has been in remission mostly ever since. It came up one flare once when I got the norovirus from my son. And again, I threw up and had diarrhea for 2 or 3 days. It returned, but D-limonene was able to put it down. We'll talk about D-limonene as a potential supplement that you can use for silent reflux. So, what are the symptoms of silent reflux, and why is it called silent reflux? Silent reflux has many different symptoms, which is why it's very commonly misdiagnosed as a health issue. It doesn't have the typical, when you go to your gastrointestinal doctor and you go, I have heartburn, I can feel acid build up in my throat, it hurts, I have trouble swallowing, that's pretty standard symptoms of GERD. You may be a little bit dyspepsia, a little bit of burping, a little bit of pressure in the stomach, maybe gastritis. But silent reflux actually doesn't really manifest itself as typical GERD symptoms. It more manifests itself as some of the symptoms I mentioned earlier, like chronic sore throat, postnasal drip, coughing, which I did not have the coughing. Some people have coughing and some people do not. The nerves in my throat may have been damaged, and that may have been why I did not cough properly like some people do. But I did have a lot of drainage, postnasal drip, esophageal spasms. Sometimes I would get tachycardia, especially after eating, kind of like those Wilhelm syndrome type of symptoms. Other symptoms of silent reflux are nasal issues, loss of sense of smell, bad or metallic taste in the mouth, halitosis, periodontal disease, a full eustachian tube, or eustachian tube becoming clogged, causing ear fullness and tinnitus. Some people with silent reflux will notice that when they swallow, they can hear their eustachian tube open and close. It's known as a patuous eustachian tube. I had that problem from time to time. Some people, if their silent reflux becomes worse enough, they can lose their voice, not permanently, but for a while, since the larynx is very susceptible to damage from reflux, and we'll talk about why that is in a little bit later. But there are asthma is another symptom of silent reflux, and so is perceived breathlessness, which is separate from asthma in that the oxygen doesn't go down, and there's no wheezing like there is in asthma, but a person still feels like they cannot get a full breath in. And I wrote in a blog about perceived breathlessness as well. But those are generally the symptoms associated with silent reflux. Also, one last thing is a globulous pharyngitis, like a lump in the throat. It's a common symptom too as well. But yeah, there are many different symptoms. It mimics many different things. Asthma, mouth, dental issues, ear issues, sinus issues, and it's all caused by this digestive tract reflux, which is GERD. So in GERD, okay, so you have two sphincters. You have the lower esophageal sphincter that opens and closes when it allows food and beverages to enter and stomach chime to exit out if you have to vomit or burp, exit out through the esophagus. And you have a sphincter up here called the upper esophageal sphincter, which protects the airway to the lungs, as well as the larynx from any type of reflux. Now, in people who have gastroesophageal reflux disease, which is GERD, the upper esophageal sphincter is relatively intact, so it closes properly. So acid gets trapped behind, in the esophagus, and that's why they have the typical symptoms of heartburn. Where in silent reflux, on the other hand, the upper esophageal sphincter is open, so the reflux goes up, and then it goes down fairly quickly because of gravity. So it doesn't get trapped. So the esophagus, though, can become damaged in Barrett's esophagus, can happen in someone with silent reflux. It generally is not the case. Actually, your stomach makes an enzyme called pepsin, and it's used by your stomach to help digest or begin to digest a protein. Pepsinogen activates in the stomach when it's exposed to stomach acid and converts into pepsin. Okay, so pepsin's activated at a very low pH and is inactivated in a very high pH, which is the reason why when it enters the duodenum in the stomach chime, your pancreas releases sodium bicarbonate, which is alkaline, and your gallbladder and liver release bile, which is also alkaline, to inactivate the pepsin, so that the pepsin doesn't go and digest your intestines, which would be, or small intestine or large intestine, would colon, which would be a horrible, horrible thing. So people with silent reflux, you reflux the acid. It doesn't get trapped in the esophagus, but the pepsin gets lodged in different places. It can get lodged in the eustachian tube, if it can reach up there that far. It can get lodged in the nasal cavity, it can get lodged in the mouth, it can get lodged in the larynx, it can even get lodged in the throat. So anytime you ingest something that's acidic, it activates that pepsin, and it starts digesting into tissue and causing inflammation, because as an enzyme, that's what pepsin does. Usually, how to diagnose silent reflux is a little bit different than standard gastrointestinal reflux disease. Most people go to a ear, nose, and throat doctor instead of a gastroenterologist, and ask them not to do a regular endoscope, which a gastroenterologist would do, but instead they need to do a procedure called a transnasal esophagoscopy procedure. So what it is it's a long tube similar to an endoscope, but instead of putting you under sedation and the risks associating with that with the endoscope and going down your throat, instead they take the tube and they go through your nose and they look down in your larynx and possibly your esophagus too. So the procedure is different. It doesn't require you to be sedated. There are risks with sedation, using any type of anesthesia. The risks are rare, but they can happen. Joan Rivers died from an endoscope procedure from negative reactions into the anesthesia, supposedly. So yeah, I call around if you want to get a diagnosis of silent reflux. Call around to your local ear, nose, and throat doctor and see if they perform the transnasal esophagoscopy procedure. endoscope procedure, so they can look down, through your nose instead of your throat to get a firm diagnosis of silent reflux. There's also the PEP test that you can order online, which is a spit test, which isn't as accurate, but it can detect pepsin, because pepsin is not supposed to be in the saliva in large amounts, or even small amounts, because you're not supposed to be refluxing into your mouth. And you just spit on the test strip, and it'll test, send it back, and it'll test positive if you have high amounts of pepsin in your saliva, which is associated with silent reflux as well. Third test is probably the best one in diagnosing it, other than the transnasal endoscopy procedure, is a pH monitoring test. It has to be a 48-hour dual sensor, one that can measure both acidic and non-acidic, which would be more of like your pepsin or your bioreflux events. That could be very useful too, but it's kind of uncomfortable of having to have a probe put, down your nose and into your throat for 2 days. But as long as you have one that does measure non-acid reflux events, separate from acid reflux events, it can be very useful in determining whether or not you're suffering from silent reflux. So let's talk about some general causes of silent reflux, and then we're going to talk about some general advice that you can do to possibly help recover from silent reflux. Silent reflux has many different possible causes that we know from studies. I have different hypotheses of the causes. They could range from upper gut dysbiosis like H. pylori or Citrobacter or Protus mirabilis or Klebsiella or Provotella. It could be caused from a person having SIBO, a person having vagal nerve issues or vagus nerve damage, causing the sphincters to not be able to open and close properly. I think possibly some sort of chronic viral infection that affects the vagus nerve and causes some sort of vagus nerve neuropathy. A lot of people got their silent reflux from after having some sort of viral throat infection. It's in classic literature, and Dr. Jamie Kaufman's also talked about it as well, as possibly being what they call a post-viral neuropathy of the upper esophageal sphincter, being the one of the main causes of silent reflux, which is definitely possible. And also, a lot of people with silent reflux too, one thing I want to mention, in studies, they had low vitamin D, and I know increasing my vitamin D from the sun was one of the biggest things that helped improve my silent reflux. So yeah, I would definitely have your vitamin D checked. 25-hydroxy and 125-hydroxy if possible. 25-hydroxy is the storage. That's usually the only vitamin D that the doctors test. 125-hydroxy is the active. You want to get both tested. Usually in silent reflux, I expect someone to have very low storage and very high active. Their body is burning through that active vitamin D to reduce inflammation and to maintain their immune system, probably from some sort of dysbiosis in their gastrointestinal tract. So, some general advice for people suffering with silent reflux. Of course, I have a more detailed blog on my website and in my book, Fix Your Gut. Or you can always contact me for health coaching. I myself had silent reflux, so I definitely understand how much of a pain the disease actually is and how debilitating it can be. But yeah, let's talk about a few things. So, a few things you can do is there's a set of exercises called shaker exercises for the neck, which are usually used for people to recover after they've had strokes, to help them with swallowing and movement of the neck. So I would definitely Google that and start looking at them. I used them for myself. They didn't seem to help strengthen the upper esophageal sphincter. You can strengthen the upper esophageal sphincter with exercises compared to lower esophageal sphincter, which I don't believe there's any way to increase the muscle tone of it with using exercises like there is with the upper esophageal sphincter. And shaker neck exercises are one way. If you feel uncomfortable about performing the procedure yourself, then I would definitely recommend getting in touch with a good physical therapist and have them run through the exercises with you. Another thing is to drink only room temperature water during meals, and don't drink a lot of water. Drink only 4 to 8 ounces per meal, and only eat 3 meals a day during the daylight for proper migrator motor complex, which is pretty much your digestive system's motility, because constipation could contribute to worsening silent reflux issues by worsening the sphincter's muscle tone over time, because excess pressure from being constipated in your gastrointestinal region. So make sure you chew your food very well when you eat too. Eat very slowly. It's common stuff with GERD, but it's still common with silent reflux too, of things that you want to do to help with your digestive system. I used to recommend drinking alkaline water. I don't as much now. I think you can get, because for one, it reduces stomach acid production, which isn't good in someone with upper gut dysbiosis. Okay, I take it back. It doesn't reduce stomach acid production. It increases stomach pH. So instead, I recommend that you drink 2 ounces of alkaline water 3 or 4 hours after a meal. So, swish around a little bit with it, help deactivate pepsin that maybe in your mouth and maybe in your larynx, as well as, drinking 2 ounces of it and swishing it before bed. That may help. Some people have had good results on Jamie Kaufman's dropping acid diet or going on a low acid diet, because there are a lot of foods that we ingest have a lot of acid in them. So even foods that we don't think, like strawberries, which are very high in acid, have a very low pH. Blueberries, a lot of your berries are very acidic. So that's something that you can do. Another thing you can do is, if you have nasal issues, you can wash your nasal passages out using a neti pot about an hour before you go to bed. That may help reduce some of the pepsin that gets lost in the nasal passageway. Sleeping on your left side at night, for some people, that can help by closing the lower esophageal sphincter. For some people like me, I did better sleeping on the right side. I don't really have an answer for that. But some people with silent reflux, actually, they do better on the right side, even though anatomically it's better to sleep on your left side because it puts pressure on the stomach and on the LES, but to each their own. Melatonin production and proper sleep hygiene is paramount for recovery. A lot of people have noticed supplementing with melatonin or even getting their sleep hygiene good helps with their silent reflux. I do not, however, recommend the use of melatonin unless absolutely needed, because it can affect endogenous hormone production of progesterone and testosterone and estrogen, and some people can cause issues with that long term. And I do recommend 2 more lifestyle changes, which is make sure you get enough omega-3 fatty acids in your diet, preferably in the form of seafood when possible, because that will help reduce inflammation, as well as making sure that you're getting enough sunlight properly for vitamin D. And I have a vitamin D blog on fixyourgut.com, and I'll put it in the notes for the YouTube video. And you can always go to my website and just type in vitamin D, and it'll come up of how to increase your vitamin D endogenously, which I do recommend people do with silent reflux. A few supplements that you could try, you can ask your healthcare professionals about. Z-carnosine worked very well for my silent reflux. It helps to reduce inflammation in the stomach and the esophagus if it's reflux, so I recommend taking 1 or 2 capsules with each meal. Magnesium worked very well for me. It reduces inflammation too, and it helps relieve constipation. So, magnesium glycinate at night, some people may find beneficial. Magnesium malate during the morning. Usually recommend 200 milligrams per 50 pounds of body weight for a person, as long as they have healthy kidneys. You can also try slippery elm lozenges, plain slippery elm lozenges, 30 minutes before meals, or DGL powder, about 1/8 of a teaspoon of Vital Nutrients DGA powder, 30 minutes before a meal. Both of those can help coat the esophagus and help improve digestion. One final supplement I'd probably recommend is D-limonene. Now, for some people, D-limonene can cause issues. It did for me initially. When I started taking it, for some people, if the esophagus is too weak or the larynx is too weak and damaged, it can trigger inflammation, do the opposite of what it's supposed to. But in other people, it can be a game changer. So I do recommend trying it. Be cautious, though, it could make it worse. If it does, then discontinue it, and of course run all of these recommendations through your healthcare professional. That's it for today on silent reflux. I hope I was able to break it down for you, and hopefully you'll be able to find relief from it. That's it for today. I hope you have a great night.